Margie has her master's degree in holistic nutrition from Hawthorne University. She is certified as a holistic nutritional counselor, also known as a nutrition consultant, and has been in practice for over 11 years. With over 10 years of experience as a medical technologist in a clinical laboratory, she is well versed in interpreting and understanding the significance of laboratory testing. Through Seeking Health Educational Institute, she is certified in 2 levels of methylation in clinical nutrigenomics, and she is an honorably discharged veteran of the United States Air Force. Having suffered from an autoimmune disease and genetic methylation imbalances, Margie truly understands how challenging recovering your health can be. Not only is she able to be sympathetic, but is also realistic because of having personally walked the pathway towards recovering her own health.
So in the webinar, and causes for the rise in gluten intolerance and celiac disease, our objectives for this webinar are to describe what gluten is and why so many people are going gluten-free. We're going to talk about the rise in gluten intolerance, especially here in the United States. We're going to explain the difference between what a gluten intolerance or sensitivity is as compared to celiac disease. We're going to understand what a gluten-free diet, if it's going to be right for you. We're going to talk about testing for gluten intolerance or celiac disease, and these tests are for people to do at home, not through a doctor's office. And then we're going to talk about some supportive supplements to help if you do need to be gluten-free. So some gluten-free basics. So what is gluten exactly? Well, in Latin, gluten means glue. It's what binds together it's found in certain grains, and it's what binds together some of these grains to make it stretchy and doughy, which is great for making bread and cakes and cookies. It is a composite of a prolamin and a glutein. And in wheat, the prolamin is called gliadin. In one way to test for the antibody to the gliadin called anti-gliadin, and we want to test for both the IgG and the IgA antibodies. So some of the reasons for a rise in gluten intolerance is because of the genetically modified foods that were introduced in 1996 in the United States. It is a contributing factor to an underlying gut dysbiosis. Gut dysbiosis is a fancy way of describing an imbalance in the microbiome, also known as the good gut flora, in our digestive tract. Many people don't realize that if we do not have a good, healthy microbiome, then we're not going to be healthy. We rely upon this good bacteria to provide nutrients for us, to eliminate toxins, to reduce inflammation. And if our microbiome is out of balance, which we call gut dysbiosis, then we're not going to be healthy and we're going to have a chronic illness. Some other reasons for an imbalance in the good gut flora could be due to overuse of antibiotics or certain medications. Even over-counter medications like Tums or Prilosec or an everyday aspirin can lead to imbalance in the good gut flora. Additives and hidden sugars in processed foods are also contributing factors. Today's wheat contains more gluten and is sprayed with glyphosate. Glyphosate is the active ingredient in Roundup, which is a common pesticide here used in the United States. And not to be confused with genetically modified foods, wheat has been hybrid, meaning that it's been through selection to contain more gluten than historically. And so gluten is a sticky protein, and it's hard for us to metabolize, and when we're eating foods that contain more gluten as in before, then it causes problems in our body and leads to this intolerance. Wheat is highly refined and processed and found in foods that we're not considering, such as condiments like ketchup or barbecue sauce. We can find it in hot dogs and a lot of processed food. It makes up a large part of the standard American diet. Some people can eat 5 to 7 servings of gluten in a day and not even realize that that's what they were eating. Gluten is found in so many processed foods. So this is a standard American diet, and we can see in all these pictures, including the one with the burger and the french fries can even have gluten in them. So next I want to talk about Roundup. Roundup is a pesticide commonly used in the United States. It is used worldwide, but we use it quite a bit here in the States. Genetically modified foods are heavily sprayed with Roundup. We know them as Roundup Ready crops such as corn and soybeans and canola. Roundup is also used on the wheat before harvest to desiccate the crop. If you're out driving in the country and you see a wheat crop that is uniformly brown, that has been sprayed with the Roundup to desiccate or kill the wheat so that when they go in and harvest it, there's more wheat for harvest. Glyphosate is the main ingredient in the Roundup, and glyphosate is derived from Agent Orange, which people from the Vietnam era recognize Agent Orange as something that is harmful to us. There's high levels of Roundup found in the end product, so in those cookies and bread and baked goods, we are finding high levels of Roundup, even though we've been reassured that it's not in those end products. In actuality, it is, and it is causing a lot of harm to our bodies. It causes the damage to the good gut flora. It weakens and it unbalances our immune system, which can make us more reactive to something like the gluten. And it leads to chronic inflammation and pain. Chronic inflammation and pain leads to chronic illness. So let's next talk about the difference between celiac and a gluten intolerance. So celiac disease is an autoimmune disease. And it's where our body produces antibodies or autoantibodies because it's attacking the mucosal lining of our bodies when gluten is consumed. It is the worst manifestation of a gluten intolerance or sensitivity. Currently, in the United States, 1 in 133 people are confirmed with celiac disease. You can have a gluten intolerance without having celiac disease, but all people with celiac disease have a gluten intolerance. And it's the same recommendation whether you have a gluten intolerant sensitivity or having celiac disease. The recommendation is to completely avoid gluten. Even a small amount causes inflammation, and again, inflammation leads to chronic illness. So I'd like to show you a chart. This is from a paper from Stephanie Senoff, and I have the reference down here in the bottom if you'd like to look more at this paper. She indicated in her paper that we can see back in 1992 when glyphosate was first introduced into the United States, and we probably had glyphosate long before that, but where it was really being used on the genetically modified foods. We can see it was starting to be used on the crops in 1992. We can see in 1996 with the GMO crops that where it was introduced, and we can see that rise, and we can see it consistently rise as more and more genetically modified crops were introduced into the food supply. We can see the correlation with the rise in celiac. Now consider that this is celiac disease. Again, that is 1 in 133 people confirmed diagnosis. This is not measuring food, a gluten sensitivity or intolerance. And so it's probably much larger than that. We can also see down here that this chart ends in 2010. If we were to see it continued out through 2019, we probably would see it continue to rise because the problem hasn't gone away. It's just going to continue to get worse. So next I want to talk about, is a gluten-free diet right for you? So there's reasons for varied symptoms of a gluten sensitivity or celiac, and as we continue with the lecture today, I'm going to use the term gluten sensitivity to include celiac disease, because we've already established that if you have one or the other, it's still to remove all of the gluten from the diet. So some reasons for some varied symptoms is consider that a gluten intolerance causes malabsorption issues in the digestive tract. In a nutshell, you cannot absorb your nutrients. It's not just digestive concerns, but it can affect all parts of the body. So it leads to chronic inflammation, and as I stated earlier, chronic inflammation leads to chronic illness. It's a great masquerader because you can have all these unrelated or seemingly unrelated symptoms and not realize that the core issue or the root of the issue is in the digestive tract as you're reacting to gluten when you eat it. It leads to degenerative diseases. It leads to adrenal dysfunction. It's like you're always running away from the tiger. It can take up to 10 years or longer to diagnose due to the multiple seemingly unrelated symptoms. commonly associated symptoms, abdominal bloating and or pain is the number one symptom, but it's not the only symptom. It can also lead to diarrhea and or constipation, and it's not uncommon for that to be alternating. People will go 2, 3, 4 days or longer where they're having constipated, then all of a sudden have explosive diarrhea that lasts for a few days. You can have gas or nausea, acid reflux or heartburn are some of those symptoms. A weight loss or a weight gain. Some people, because of the damage to the mucosal lining, are not absorbing their nutrients and they just cannot keep weight on. And then you have the other end of the spectrum where people have so much inflammation that the inflammation is leading to weight gain. And that has to do also with nutritional deficiencies leading to the weight gain. I have people that tell me I can just look at those cookies and it seems like I gain weight. And that can be due to the gluten sensitivity. Fatigue, and I'm not talking a little bit of fatigue, I'm talking extreme fatigue, where all day long you're tired, you wake up in the morning and you're tired. It can lead to brain fog, irritability or anxiety. It can also lead to melancholy. You just don't have the motivation to do anything. Some other associated symptoms could be joint and or bone pain, mouth ulcers. It can lead to a hormonal imbalance both in men and women. It can lead to infertility issues, again in both men and in women. It can lead to a short stature. That doesn't mean that you were, say, 5'6" and then all of a sudden you shrink down. It's more to when we see that in children. Children who failed to thrive and failed to hit those anticipated growth patterns. Maybe they're always down in the low 20 percentile instead of being at a normal growth pattern. And that's where we see that short stature. Tooth enamel erosion, and then headaches and or migraines can all be attributed to a gluten sensitivity. So these high-risk diseases that I'm going to talk about next are actually from the Quest Diagnostics booklet that you can access through the Quest Diagnostics website, and that's what they've listed from their brochure talking about celiac disease. So insulin or type 2 diabetes, now consider that this type of diabetes is the autoimmune disease. Autoimmune thyroiditis, also known as Hashimoto's or Graves' disease. Hashimoto's if you have low or hypothyroidism. Graves' disease if you have high or hyperthyroidism. Down syndrome, selective IgA deficiency, unexplained anemia that could be due to an iron anemia or a vitamin B12 anemia, but when it's unexplained and it's chronic. Premature osteoporosis. Some other associated diseases can be other autoimmune diseases such as lupus or Sjögren's disease. Skin diseases such as psoriasis or eczema. Dyspraxia, which is a fancy way of describing being klutzy. Autism, arthritis, and that's both osteoarthritis and rheumatoid arthritis. Irritable bowel syndrome, irritable bowel disease. I could have added Crohn's disease here. Fibromyalgia, and type 2 diabetes. This is the acquired diabetes, not the autoimmune disease. We used to call that adult onset diabetes, but we're finding it in our children at younger and younger ages. So I next want to talk about a type of disease that comes out through the skin. It's called herpetiformis dermatitis. And as you can see on the person's feet here, these are in the areas that rub against the shoes or where the socks, that's typically where it comes in. It can be on any part of the body where the clothing is rubbing. And we can see here, it's an itching, blistering, burning rash. It is a cauliflower type appearance, which we can see here under the magnification. We can see it comes and goes and it never fully heals, and it can move locations. So one day it might be on your ankles and the next day it could be up on the wrist or at your waistband where your pants ride against your skin. This is known as a skin-associated celiac disease. So could symptoms be related to gluten? Let's think. IgA antibodies, immunoglobulins are predominantly found in the digestive tract. Okay, and that we talked earlier about the selective IgA deficiency. So if you're constantly reacting to gluten, it can lead to an immune deficiency because you're constantly fighting the tiger is a way of thinking of it. Gluten can be inhaled or consumed or absorbed through the skin. So people who are gluten intolerant, especially somebody who's ultra sensitive like somebody with celiac disease, if they go into a bakery or a pizza place where they're baking or preparing glutinous foods, they can have a reaction. And a lot of people don't realize that they're having this reaction. They don't feel good, and in actuality, they're having a reaction to the gluten in the air. About 76% of close family members can also have celiac disease. So if you are diagnosed with celiac or gluten sensitivity, then there's a 76% chance that your close family members, such as your siblings, your mother, father, your children, could also have the disease. It's a very common for one person to have it, for others to have it. It can oftentimes take up to 10 years to diagnose, and it takes about 10 years for that amount of damage to occur in the digestive tract for it to be diagnosed. Doctors are getting faster about diagnosing it, but it still takes a long time. There are many symptoms, or think about it, how many symptoms or related diseases do you have? So if this is how you typically feel, then looking for a gluten sensitivity is highly recommended. So next, let's talk about testing. So for celiac testing, I highly recommend a complete celiac panel that includes both the IgG and the IgA antibodies. It's not uncommon for a doctor to just order a partial panel, and then you end up with negative results. So I recommend, again, a complete panel, and that is available through my MedLab. You do not require a doctor's orders to be able to order this for yourself. This is a blood draw through Quest Diagnostics. The downside to this test is you must be eating gluten for this test to detect the antibodies. Okay, and remember, celiac disease is an autoimmune disease, and so we're looking for the anti-gliadin antibodies to both IgG and IgA. If we're looking for a gluten intolerance testing, there's an ALA test, which is the name of the laboratory. It's an IgG food antibody. There's 96 foods on it. It does include other foods such as dairy antibodies. Also done through my MedLab. It's a home finger poke, and here's the website for that. And then Great Plains Laboratory has a gluten casein. Casein is the protein in the dairy, and they're peptides. If you're not properly metabolizing gluten and or casein, then if you measure these peptides, and we pick them up, we know that your body's not properly metabolizing them and having inflammation and an immune response to those peptides. And here is the website for that. So some laboratory testing insights. Traditionally, a GI scope with a biopsy is considered the gold standard for testing celiac disease. But let's consider some things about that scope. First off, they're measuring something in the small bowel, which is about 20 feet long. And when the doctor is in looking for those damaged villi in that mucosal lining, there's 20 feet that they have to look through, and that's an awful lot of intestinal area to look at to see if there's damage, and it would be really easy to miss. Not to mention that this is a very invasive testing, so my attitude is to do the blood work instead. The blood work is a comprehensive testing, and it's very sensitive and specific. You either have it or you don't. But either way, whether you're gluten sensitive or have celiac disease, the recommendation is the same, 100% gluten-free diet. So some supportive supplements, if you do have the gluten sensitivity, would be to include a digestive enzyme that contains DPP4. DPP4 is a protease, so it's breaking down those proteins. Now, if you're taking this digestive enzyme, that does not give you the green flag to just go eat gluten because you're taking this enzyme. This is if you get cross-contamination or a small amount, we call it getting glutenized, then this is something that can be really helpful for you. And it won't just break down the gluten, but if you have produced molecules or compounds against the gluten, it will break those down also and help you to feel better much faster by reducing the inflammation. So Claire Labs Vitalzymes or Designs for Health Digestymes both contain the DPP4 and have a good amount of the DPP4 in it. These are professional level supplements that don't contain gluten or other harmful additives. A high potency probiotic such as the Claire Labs Therabiotic Complete. This probiotic has over 25 billion colony forming units per capsule. It has a combination of lactobacilli and bifidobacteria in it. And Claire Labs is one of the leaders in probiotics. It is a refrigerated probiotic and there's no other harmful additives in it. And then I have a mucosal lining support. I like the Designs for Health GI Revive real well. It has the glutamine in it needed for repairing that single layer of mucosal lining. It's an amino acid needed for the repair of that. And it has other things in it like marshmallow root and aloe vera for healing and reducing inflammation in the gut. So I've given some pictures here. These are available on my website, circleoflifenutrition.net, or from another practitioner. So the next thing that I want to talk about is, should dairy also be eliminated? So dairy contains opiate type substances called caseomorphines. The gluten contains gluteomorphines, and the dairy, the casein, it's the casein, not the lactose, that produces these gluteomorphines. When our body is not able to properly break down the gluten, it also lacks the ability to break down the casein from the dairy. These are large proteins. And when we're producing these gluteomorphines or caseomorphines, it has an opiate effect on the body. It's very much like being on heroin. It can lead to addiction issues. It can lead to ups and downs in mood or energy. Gluten and casein, there is a strong cross reaction between the two proteins. Again, the DPP4 digestive enzymes, when we lack the ability to properly metabolize those, oftentimes our body is lacking in this enzyme, and taking a supportive enzyme is helpful. Again, you want to test for both the IgA and the IgG antibodies, because if you become diminished in the IgA antibodies, we want to be able to measure the IgG for both the dairy and the gluten. The ALA test that I recommended earlier does have the IgG antibodies for the casein and other milk proteins. Many people feel better if they eliminate the dairy during the healing process. The first 6 weeks is the most significant for feeling better. It takes about 6 weeks for the gluten to leave the body, but it can take actually longer, up to 3 months. If you're going to introduce dairy back into the diet, possibly switch to raw dairy, which is easier for the body to digest. So in conclusion today, being on a gluten-free diet is not the end of the world. It is worth the improvement in your health. You are not alone. You have lots of company, and the numbers continue to grow. Test before beginning the diet to see if you truly have the gluten antibodies. I find that if we just speculate if you're gluten intolerant, it's easy to just reduce the gluten in the diet and not really stick with the diet. But if you have lab testing to show that you truly are gluten intolerant, most people are more committed to being on a gluten-free diet. And then watch Wholesome Nutritional Gluten-Free Diet for Dummies for our next YouTube video if you want the dietary recommendations.